and sweeping cards in different cities. You can see this map showing you how they are moving around. And I will show you another card from the another data sources that we have. But this is from the COVID positive, and you can see a lot of, commuting situation during the phase. And we have to think about this if we're gonna live with the coronavirus in next months. Next slide, please. We actually asked the central bank to give us 100,000 individuals financial transactions. They are random and they are not COVID positive. So they give us this data, and this 6 you can see here is first 1 month before finding the first case. So 6 weeks before the finding first case. So at that time, the number of the transactions was n, and we considered as a 1 or 100%, and consider this number among general population, how it declines, which shows that people are scared and not going outside and doing the business, regular business. So it came up to the last month to close to the 45%, sorry, which means the social distancing get achieved to the 55% considered the what actually government and Ministry of Health have done. So 55% of the number of transactions reduced, which means we were exposed less to the spread of the infection during this time. Next slide, please. And these are different businesses. If you look at the right side of the slide, it says, for example, for restaurants and coffee shops, we get negative 86%, which is reduced the 86% of the whole business. And also internet and mobile, 95%. And healthcare facilities also had lower level of the transaction, because many of those elective operations or procedures and regular visitors were just gone, and only remained the situation, all facilities working for COVID positive epidemic. And many of those private hospitals and clinics were closed during this time. So the reason for that is this. The good news is for the one before the last, toll reduced to minus 70%, which means people are not going more outside the city to have a payroll for the system. So it is a good news also. Next slide, please. But for the next time, if we had again with another peak of the pandemic, we use that 100,000 individuals transaction, and it showed us surprisingly that we have several areas. Each color shows you the people who are having more transaction with each other. So if you wanna do something like isolation, it doesn't need to be at the city level. You can keep it without hurting the economy situation. You can keep it in the different color. For example, people who are living in the East and West Azerbaijan, they are doing more than 90% of their business with each other in that area, Erdebil, Azerbaijan, East and West. And also people are living in the Ahvaz and those area, more than 90% of their business are, with each other. They are not, they have different, for sure, actually transaction with other cities, but mostly over there. If you isolate this area, you can make sure that you have better actually control of the COVID without hurting the economy of the area, that specific area. Okay, next slide. And the last one is actually illustration of how the cases and general population are actually merging to each other, and they have exposure to each other. And it's actually example of this. For example, consider this as a grocery situation, the big one with a lot of green and also red. Many people goes to this business and they are exposed to each other. And those that red are very high, consider as hospitals and healthcare facilities. So still we have a lot of mixture between, and the isolation is not in the ideal situation, even though we know that we reduce the level of the exposure by 55%, but still we have a considerable mixture between people who are positive and they are not respecting the self-isolation rules. That's all what we have done during the actually COVID-19 pandemic. And I again thank you so much for the Mustafa Foundation to provide such an opportunity to share my experience. Thank you so much.
Thank you, Professor Fazadfar. Thank you for keeping the time, but still we are 5 minutes behind schedule. So I'll try to make the time shorter for question and answers.
Sure.
I did not have received any question from audience, but I have a couple of questions myself. First, you know, the experience of some countries who have done better track and trace of patients, COVID-19 positive patients. The result of mitigation and control of disease in those countries are far better than countries who have done, for example, measures like us, quarantine and the closing down business and closing down lots of activities. For example, in South Korea, to track and trace patients.
Correct.
And keep them away from the society. This shows far better results than to lock down the whole country. That is why some countries, for example, Sweden, they did not go for lockdown, for total lockdown.
Correct.
I guess from the activities you have done, it's probably you could have tracked and traced positive patients because you know the ID number, and then you can track and trace them and to find them if it is possible somehow to help the officials to track those people and self-isolate them.
Yeah.
So I guess we need to have more testing and to find positive people and lock them down.
Yeah, thank you so much for a very comment. But there are two problems with this inside Iran. We are talking about the Iran situation. We had 440,000 tests. We have done this for general population, which is very, very low compared to the other countries like South Korea that you mentioned. More than 2% of the population got the test. And also United States and many other countries like UK and other countries. So we need a lot of tests. And we are on the sanctions. And we are not able to have access to enough tests that we needed, actually, or we wanted. So this is one problem. Nowadays, there are many efforts inside Iran to produce the kits for the tests, but still it's ongoing, and hopefully we can do this. The second part is the rules and regulations for that are positive, and we don't have it in Iran. We mentioned it several times. The Ministry of Health announced if they don't respect to the rules and regulation for being self-isolated. The last slide shows you that they are not respecting this number. So exactly, your comment is very valid and exact. And the problem is two things. One is the number of tests inside Iran is very, very low compared to general population, and then the percentage of the tests that we have to do. And the second part is the people who are diagnosed with COVID positive, and they are, they are not in the bad situation. They can take care of themselves inside the home. They are not staying at home. So not all of them, but some part of them. And the graph that I mentioned in the last graph show you how the mixture is when they are using the, the different markets, going to the grocery store, using the credit card and so on. So definitely it is the way that we can do it in the next peak if it happens, to make sure that we have enough number of tests to do at least 2% of the population, which means 1,600,000 tests, and also make sure that we have a very good rules and regulations and enforce that rules and regulation inside the country.
Any other recommendation from your results about how to behave for the general population? Any specific recommendation that we can derive from your findings?
Actually, the main finding is, as you mentioned, do the test, do the tracing, and do the surveillance to make sure that the seroepidemiology situation inside the country from the Ministry of Health side. And from the people, the main part is to make them sensitized, sensitized, consider to the situation, and make them informed. These two key elements make the epidemic under control. If people are sensitized, consider the situation that they have, and also the information that they have, because there are infodemic problem also. We have two challenges. One is giving the right information or correct information to the people, and also keep them away from the many wrong information that we saw during this epidemic across the social network and many other ways that people are intact with them.
And I guess there are a couple of new findings from your data mining results regarding patients who are more at risk, for example.
Correct.
And people with some comorbidities that, for example, if I guess we were told before that immunodeficient people are far more at risk, but now we found that malignancy
is much higher.
Higher. And also the cough symptom is it's good for the patient. If you have coughing, then you are less probable to die if you don't have.
That's correct. Yeah, this is another one.
Okay, thank you very much.
Really appreciate that.
Thank you, Professor Fazlfar. Our next speaker is Professor Sharina Muhammad Siddiq from Malaysia, Deputy Director of Cancer Resource Education Center, University Putra, Malaysia. The title of presentation is Sharing Experience and Observation from Malaysia in Dealing with COVID-19 among Patients with Cancer. Professor Sharina? We are waiting for your... Can you start, Professor Sharina? If you hear me. Not connected yet. I guess there are behind the scenes efforts to get us connected. Okay, I am told that we have a problem in getting connected to Professor Sherina. It may take a couple of minutes to get connected. So hopefully we'll be able to sort out the connection problems. We had so far two speakers. First one, Professor Charagali, who talked about the convalescent plasma therapy experience in Iran, and he showed that this experience was successful. Of course, the number of patients, about 50 patients, which is much higher than those reported Vox earlier reports, and it showed that this method is useful, subject to being used at earlier stages. For those patients who are hospitalized, it's better to treat them earlier and don't leave the transfusion for later stages. Our second speaker, Professor Farzad Far, he talked about some application-based method for collecting data regarding people movement, and also regarding the area with higher risk of coronavirus infections in Iran, and he showed that how the patient have followed the recommendation from health officials for self-isolation, and also if the lockdown of the country have been successful, and we were showed that what business have been more affected by, and they have received higher impacts from these lockdown measures in Iran. And also he presented about some data about the patients, not the general population, about COVID-19 patients, and also those patients with comorbidities, and some interesting results regarding which comorbidity was creating higher danger and for the life of patients. For example, cancer patients are more at risk, and some other patients are at lower risk, and these are good findings that health official can utilize for further mitigation efforts, and also public health initiatives in Iran and also around the world. Okay, I am told that the good news that Professor Sharina is getting connected to us and also to the application. So we are waiting for Professor Sharina to come over and start her talk. Professor Sharina, can you hear me? Can you hear me, Professor Sharina, from Malaysia? I guess. Can you hear me, Professor Sharina? We have your picture on the screen, but we don't have your voice yet.
Yes, I can. So I can finally hear your voice a bit now, but I couldn't hear anything at all just now.
Okay, so we have your voice and your
And
picture.
I can't see what's happening.
Please.
Yeah.
Okay, please, can you start?
Is the chairperson talking to me, because I can't hear him clearly at all?
Yes, Professor Sharina, we hear you and we see you. Then we would like to ask you to start your talk. صدای من رو ندارن.
I'm so
اگه در
sorry, I
اتاق
can't hear you.
اگر تو اتاق فرمان میتونن با ایشون صحبت کنن، بفرمان که شروع کنن. We have your voice and picture.
Okay, I'm starting now. Assalamualaikum again. And a very good afternoon to all the participants and also the speakers. I'm so sorry, on my end, I am unable to hear the chairperson at all. And I don't know what is happening, because I can't really see myself, but I have been told to just proceed with the greetings.
Yes.
So I just want to thank the organizing committee for inviting me to present and participate in this very important webinar. It's 2 o'clock here now in Malaysia. So I will start with my slides, if I can see them, which I still can't see my slides actually. Can you please put on my slides for me?
اسلاید خودشو
Can you please put on my slides for me, because I can't see them. But I have my own slides here at the desktop, so I'll just start presenting them from my desktop. So I'm presenting on sharing experiences and observations from Malaysia in dealing with COVID-19 among patients with cancer. So as we all know, the COVID-19 pandemic has been a great challenge for everyone, and including cancer patients. They are among the groups affected by the spread of COVID-19 outbreak in Malaysia and also worldwide. So this pandemic actually can result in direct and indirect effects to physical and mental health of cancer patients. So based on a survey among cancer patients by the Cancer Resource and Education Centre, University Putra Malaysia, some patients who were undergoing treatment during the movement control order were affected by the situation of the COVID-19 outbreak. So the MCO was implemented as a preventive measure to control and reduce the spread of COVID-19. And this order was commonly referred to in local and international media as lockdown or a partial lockdown. And due to this implementation, some treatment sessions had to be rescheduled to reduce congestion in hospital wards as a precautionary measure for infection prevention. So, but patients with certain conditions and who could financially afford to continue their cancer treatment in private hospitals were referred to selected private hospitals which could offer the necessary treatment for the patients. There were patients undergoing chemotherapy treatment who actually needed to change the method of treatment. For example, one patient said that she had to change from intravenous administration in the hospital to oral treatment at home. So the MCO did cause some difficulties to obtain treatment in hospitals, especially for patients who needed to travel from a different state to another state for treatment. For your information, Malaysia consists of 13 states and 3 federal territories. And because the interstate travel was controlled under the MCO, and not all states provide treatment services and oncology facilities for cancer patients, these patients needed to go through a number of road restrictions and they had to show proof of appointment letters from their hospitals. And some patients needed to be accompanied by at least one family member while undergoing treatment. And this situation was quite difficult during the MCO, as only one person was actually allowed to be in any vehicle during a certain period, which was at the beginning of the MCO implementation. And in addition, patients needed to face their own fears and anxiety in facing COVID-19. There were patients who avoided continuing treatment in the hospital due to worry about the risk of COVID-19 infection. So what was done to help cancer patients in facing COVID-19? Our Ministry of Health Malaysia continued to provide the best care possible for all patients, including cancer patients, during this pandemic. And most of our organizations, government and private hospitals, government and non-governmental organizations, worked in collaboration with each other to organize webinars, collect funds, and provide much needed information via Facebook, Instagram, and websites. And there were online counseling sessions and helplines, which were also provided. Patients could contact their healthcare providers via emails. They were advised to adhere to the prescribed treatment plan of the healthcare providers, because this was actually based on risk assessment and guidelines from national and international evidence. Cancer support groups were available, and patients could contact one another via phone calls, WhatsApp, and emails. So all cancer patients were advised, importantly, to adhere to all the COVID-19 protective hygiene guidelines, such as practice high levels of cleanliness with regular washing of hands, not shaking hands. Okay, in Malaysia, we have the salam, and there's hugs and kissing as well. So we're all advised not to do that. Practice social distancing. Stay in our homes except when the patients needed to go to the hospital for treatment. Always wear face masks while in public, and preferably avoid going to public places to reduce the risk of COVID-19 infection. And while they were in the hospital, had to adhere to all the mitigation, protective, preventive measures of COVID-19. So if the patient had a COVID-19 symptom, for example, fever, cough, or shortness of breath or while they were at home, or if they had had contact with a patient or with another person who had been infected, the patient had to contact in advance to obtain advice before coming to the hospital. So patients were advised to also practice a healthy lifestyle, such as eating healthy food and having healthy dietary practices. Family members and carers of cancer patients also play an important role in maintaining the patient's health. They should practice all the preventive and protective measures of COVID-19 for their own safety, and especially before meeting and touching the patient. So cancer patients and carers were advised to obtain information about the treatment and management of cancer diseases from the right source, because there was an overload of information going about at that time. So it was really important to get the proper information from the correct source and wisely manage their emotions to remain calm and not panic, because uncontrolled stress can increase the risk of depression and anxiety disorders, as well as reduce the immunity of these patients. And the carers were told that they can actually advise the patients to seek healthcare services if necessary, and they themselves can also seek these services if they needed them. So some of these services were also provided by my center in UPN. So CARE is an institution that provides educational and support services for cancer patients, family members, NGOs, cancer volunteers, and the public. So there's various information about cancer which is accessible for free on our website and also on our Facebook. And during the period of MCO, our CARE helpline service was still operating via email, even though we were unable to be physically in the office at that time. So what we are doing now is updating and uploading many of our books from our resource center. And to date, there has been more than 10,000 hits and downloads of our books. So I have actually come to the end of my presentation, and I thank you for your attention.
Can you hear me? Okay, unfortunately, we have this connection problem. I wanted to ask a question. I guess you are not hearing me. No. What I read from the screen that she is not hearing us. I wanted to ask a question, but I just make it a comment. So the work about how to treat cancer patients during this corona pandemic, it's an important work, because our last speaker showed that most people at risk are those with comorbidity of cancer. So cancer patients, they have two problems. One problem is they are far more at risk when they get coronavirus. This is one problem. So a cancer patient, if gets coronavirus, it's become COVID-19 patient, he or she is at more risk compared to other COVID-19 patients. Another problem is access to their own treatment, because unfortunately, this is the experience in Iran as well. They do not have easy access to treatment as compared to before corona pandemic. So this is another problem. Even some of them, they may delay their chemotherapy, and this is not a good news, because cancer patients have to get treatment at the right time. So we have two problems for these patients, and I would like to thank Professor Sharina from Malaysia to talk about the management of cancer patients in the era of corona pandemic. Our next speaker is Professor Daryono Hadi Jahjono from Indonesia. I'm not sure if we have connection with our next speaker. Professor Daryono is Dean of the School of Pharmacy, Bandung Institute Technology from Indonesia. His title of presentation is How Universities, Private Sectors and Non-Government Organizations Contribute in Fighting COVID-19 Pandemic. Okay, we shall wait perhaps for a couple of minutes to get connected to Professor Daryono from Indonesia. There are efforts behind the scene to get connected. This is our first virtual meeting, a STEP virtual meeting, and I'm sorry for all the troubles happening. It's not unusual to have speakers from around the world. Our next speaker is not available yet, because I think we finished earlier with our previous speaker from Malaysia. She tried to talk fast as possible. So she finished much earlier, 15 minutes earlier. That is why our next speaker from Indonesia, of course, perhaps he expects to get connected within next 10 minutes as scheduled before. We're hoping that we can get connected to him before the scheduled time, because on the schedule local time, Iran okay, I was told that he is online. Professor Daryono Hadi from Indonesia. Sorry that we call you earlier than scheduled, but we finished earlier for our last speaker, and that is why we expect you to come over, please, if you hear me, Professor Daryono.
Good afternoon, I'm here. And good afternoon, I'm here. And good afternoon, I'm here. And good afternoon, I'm here.
Professor Daryono, we don't have your picture yet.
Professor Daryono, we don't have your picture yet.
But we have Echo. Echo. Yes. We're waiting for the system to get sorted out.
You can hear my voice?
Yes, Professor Dariano, we can hear you. Can you hear me? Professor Dariano, if you hear me, Professor Dariano,
I think,
hear me? Professor Dariano,
I think,
hear me? Professor Dariano. If people in the conducting room, can you please talk to Professor Dariano that he can start? Let's not wait for me to get connected to him.
Hear your voice from here. I think your microphone is mute.
بچهای اتاق فرمان شما با ایشون صحبت
Please
کنید که شروع
unmute
کنن.
your speaker.
چون ایشون صدای منو نداره فکر میکنه میکروفون بسته است. شما لطفاً اگه میتونید صحبت کنید که شروع کنندی. بسیار عالی. Could we have Professor Dariano on a screen, please? The connection is sorted out. Then we are waiting for Professor Dariano to start. خسته نباشید. من اصلا مطمئن نیستم که صدای ما پخش میشه توی برنامه آنلاین شما. Okay, we have lost our connection to Professor Dariano. We are waiting to get connected again. Sorry for these troubles. We have always problems with microphone, but this time it's perhaps problems with online connection as well.
Hear your voice from here.
Okay, it seems the connection is done. We are connected now and waiting for Professor Dariano to come over. It seems that we have lost the connection again, so waiting for the connection. Sorry that we are not connected yet. Still waiting. Have scientific achievement, real achievements without networking, without team working. Those who attend in a scientific meeting, the first objective of them is to get knowledge firsthand. That is the first objective always. You know, STEP started as a side event for our Mustafa Prize ceremony. Then it became clear that it can be a separate program for itself and not related to the ceremony itself. Therefore, we have had so far 6 STEP meetings, 3 concurrent with the ceremony itself and 3 separate in different countries, for example, in Malaysia, in Oman, in Pakistan, and also those steps which are held currently to the ceremony itself. Of course, they are held in Iran. 7th step is going to be held virtually. We cannot have a meeting by physical presence of scientists. And the theme of this meeting is going to be about coronavirus and COVID-19 disease. Fortunately, our previous Mustafa Prize winners, they have had some works in this topic. For example, Professor Gulshahin has been able to develop a mRNA vaccine to fight against coronavirus, and his vaccine has been approved to go into the clinical trials. Human trial is being developed as a joint project between his own company BioNTech and also Pfizer, which is the biggest pharmaceutical company in the world. And also we have Professor Jakin, the first winner of Mustafa Prize, who has worked in the area of early detection and fast detection and diagnostic kits for viruses, different viruses. He even talked about in one of our STEP meeting about how to detect viruses by, of course, nanotechnology-based techniques. Her work was about Zika virus, but this time she's going to talk about coronavirus detection. And not only prize winners, Mustafa Prize winners will be talking in this virtual meeting. We are going to have other scientists, big scientists who attend from many other Islamic countries and also beyond Islamic countries to share their achievements and their Okay, I guess
I cannot
we
hear
are connected.
your voice from here.
Hello, yeah.
We have your voice and your picture. Professor Daryano Hadi, we are waiting for you.
Berikutnya Bapak Angga Rusdinar, kami persilakan Bapak. Bapak Angga. Siap, terima kasih Bapak. Untuk selanjutnya, Ibu Erika Langsung. Ya, mana? Siap, pertengahan kelas. Ya, terima kasih. Reviono, ya. Reviono. Untuk berikutnya Bapak Arif Satria. Ini dengan Bapak Arif ya Pak, terdengar ya Pak?
Okay, Professor Daryano, you can start.
Terima kasih Bapak Nasir.
Suaranya kenapa nggak kedengaran dari sini?
Siap, terdengar jelas Pak ya suaranya ya Pak?
Cukup bagus, terima kasih.
Ya, terima kasih. Ibu Ratu. Bapak Arif.
Ya, cukup jelas dari Ibu sebagai satu cukup jelas.
Siap, alhamdulillah. Bapak Arif. Bapak Arif. Bapak Didit. Bapak Didit. Bapak Didit. Mulai dengan
Hello. Hear my voice. My voice. My voice. My
selanjutnya Bapak Sakit.
Ya, saya suaranya jelas sekali.
Ya, Bapak Sakit. Berikutnya Bapak dari RSC Aceh.
Bagus, selamat siang.
Selamat siang Bapak, terima kasih. Selanjutnya Ibu ikut dari KPR. Dari Abu. Belum ada sepertinya ya, kita selanjutnya
Okay, good afternoon, everyone. First, I would like to thanks to Mustafa Science Technology Foundations for getting me to join the virtual meeting today. Ya, ya bisa. Selamat siang. Assalamualaikum. Ya, makasih. Ya. Yeah, today I would like to talk about how university, private sector, especially for the pharmaceutical company and medical device company, as well as NGO in Indonesia, contribute to fight COVID-19 pandemics. This is my outlines of the outline of my talk. So first, introductions, contributions of university and academics, and then the private sector, especially for the pharmaceutical company, and how also NGO to support the people and government to fight the COVID-19. Next slide. Okay, it is at glance about Indonesia. You can see here that from the east parts of Indonesia to the west of Indonesia, we have 3 time zones, west, middle, and east, and our country covers about 17 islands. And the population of our country is now about 270 million. So if we look at the health facility in Indonesia, we have enough hospitals. In total, it is about more than 2,000. And the ratio of the hospital beds to population is about 1 to 1,200 people. And we also have medical device company that supports medical device as well as personal protective equipment and so on. But at the early of March, unfortunately, we have the shortage of the PPA and here is the data published by the government. The government has the National Disaster Management Agency, and this data is published daily. And this agency also controls the information around Indonesia, as well as appoints some hospital to take care for the COVID-19 patient. And until yesterday, there are only 140,000 people that have been tested for COVID-19. So we still have a challenge that the real data published the that I think more than twice of the data published to government are infected by the COVID-19. As you can see at the left side, that on the other source that the positive people is still increased. So we still takes the statistics from the government. So how the university support the government, especially in the national disaster management system, because they all have sought for the PP and others. So the universities from the late of March, they starting to make innovation. How it helps the government, especially the PPA that have been not enough from many hospitals that take care from the COVID-19 patient. So for example here, the university from Surabaya Institute of Technology collaborate with the Langga University Teaching Hospital, produce robots to deliver medicine, food, as well as PPA to the patient rooms. And the right side, you can see here our university works together, lecturers, students, to design ventilation that's very important in these times. And university funds, as well as collecting from fundraising from alumni, we design and produce this ventilator. Just only 2 months, they can finish all requirement, as well as the requirement from the Ministry of Health. So they testing for endurance, from the safety and so on, and they can finish in the 2 months. Here is how students contribute in design and finishing the ventilators before final products produced in our aircraft industry facilitator. And this ventilator is fully funded to hospital that take care COVID-19. So there are many publications that it is cheaper than available commercial products, and even we can buy with higher price, but there's no products available in some market. So it is great support from university to take care of people affected by COVID-19. And here some designed and produced by some university, not only from our university, Bandung Institute of Technology, but also designed and produced by other university to support all hospitals in Indonesia. Okay. Next slide. So the model is from the very simple to the complicated one that can be used for the ICU. And because the personal protective equipment is not enough in the market, and many people need many university also their fund to produce this PPA, mask, hamsats, facelift, and so on, and then distribute it to the hospital as well as to people's needs this PPE. So we are very happy that many universities can help people to protect their safety from the COVID-19. Okay, next slide. And here is our, please come back to now. Yeah, okay, thank you. Here are the innovations, and that's likes for Muslims. Yeah, Muslims every day 5 times wash their face, hands, and so on in their wudu. Yeah, and public sanitizing hand wash that's designed and produced by some university, and then these products distributed and placed in some public area, for example, in the traditional markets, malls. Even now, mall is closed everywhere, and also this hand wash sanitizing was in the prayer area in the mosque. Even now, people's prayers from their house, but we still need this facility, especially in the near supermarket, because supermarkets still operates from 10 p.m. to 10 a.m. to 5 p.m. So people need to wash the water to prevent from COVID-19 pandemics here. Okay, we can move to the next slide. Not only fund from alumni from university, but our students, our lecturers, faculty member collect some money, and then they bought some medicine, the very important medicine, food supplement, vitamin, and so on, as well as mask, handset, and others. And then they distributed to primary care facility and as well as hospital. But they also distribute or give this medicine, food supplements, vitamins to people directly. Yeah, not only to the healthcare facility, but also to people who need masks and so on. Here you can see some hospital, and here students and lecturers visiting some spot and distributed masks, PPE, and so on, food supplements and medicine, especially the OTC medicine to prevent the infection. So student and lecturer also directly to visit some area. There are many poor people stay there, and then we distributed not only medicine and PPE, but also we also giving some food for them. All the contributors and faculty member, for example, in our city, that we need some laboratory that can test people against COVID-19. So our lecturer and student to be voluntary and to be operator in some laboratory, especially for local major city as well as, but only in West Java. Some that facility also donate the facility as well as the to work together for this COVID-19. Another way, they also join with the government's team, for example, for data analysis, conditions, some center for clinical trials of the herbal medicine, for example, as well as supplement will support or to be act as immunomodulator testings for the clinical test. Certainly, it should be approved by the Food and Drugs Administration, and they conduct clinical trial together during these pandemics. In one case, it is very important to support the government to protect the people, but in another case we can join together to make research collaboration, especially for the clinical trial of the products developed by universities. Okay, next slide. Yeah, this another way. We also conduct some like this moment to educate people regarding the COVID-19 through the webinar like this one. We can educate people how to protect themselves and so on, as well as they also protect for their family, especially for the elder peoples, our family. And our university, I think same with other university in worldwide, that students be suggested to be at homes. In this time, we on the time of Ramadan, it is I think a big problem for Muslim country, because like in Indonesia, at the end of the Ramadan, people from the city will visit their family in their own city. It is very dangerous really, because the level of this COVID-19 will spread fastly. But government has give attention to the people, that people not leaving the city, stay at home, and after this pandemics will end, and they can visit their family. So it is very important to educate people. They should work together to prevent the spread of this COVID-19. Okay. Two former cases is a contribution for the universities, and how the private sector support the government to fight COVID-19. So you can see here the director of National Disaster Management Agency received donation from the Dexa Medica Group. The Dexa Medica Group is the third largest pharmaceutical company in Indonesia, and they donate medicine, especially here is chloroquine and hydrochloroquines and azithromycins to treat the patient in reference hospital or hospital appoints by this agent to take to treat the COVID-19 patient. So they donate some dosage, and they said that will be enough for 35,000 patients, and it is a good support to government, because the government also have limited budget to treat the patients. Okay, next. Here is the donation biopharma groups. The biopharma is I think some people know the biopharma is the largest, one of the largest vaccine manufacturers in the world. Especially, I think only some vaccine manufacturer in and biopharma have some facility, and they have another 3 pharmaceutical company join the holdings groups, and they also donate some many medicine, especially here is chloroquines that used to treat the false medicines. Here we use chloroquine, hydrochloroquine, as favipiravir, remdesivir, and depend from the medical doctor. So the chloroquines and hydrochloroquines, we have some pharmaceutical company that produce this medicine. So I think it is enough for Indonesia patients COVID-19. The products from the pharmaceutical company in Indonesia. Next slide. The others big pharmaceutical company, there is Kalbe Groups. The Kalbe Groups also donate some money to the National Disaster Management System to support the patients COVID-19. They also their laboratories, that is the Kalgen InnoLabs. They join with the national networks for the COVID testing. So I think it is a great contribution from Kalbe Pharma, Biopharma, Dexa Pharma to support the government in the treats the COVID-19 patient. Next slide. And yeah, not only from the public sector and university, but there are many support from the non-government organization. For example, here is WeCares. One time I was invited by them, and we have talk show like talk show in television, and then they share with the people, because we should educate people not only by webinars and seminars, virtuals, because in the webinars and as well as in the like usually only some people that has more knowledge, but from the televisions and all this radio and others, we can educate more different people. Yeah, from people that with very limited education to the high peoples, we can share our knowledge about the pandemics, as well as, for example, the using how use herbal medicines as immunomodulator or things supplement. So we can share with very broad people's television, radio, and radio, for example. Okay, next slide. Yeah. For example, pharmaceutical company, university, and so on can support innovation, as well as their fund to the hospital, primary care facility, and so on. But here NGO can directly support many people who lost their job, for example, because during this working from homes, many people also should be at home, cannot find some money. So it is very they should very struggle to fight this time. So many NGOs as well as companies also using this corporate responsibility to support not only their labor or workers, but also they share to the local governments, and then they distribute especially food to face this medicine or food. So very happy that NGO as well as CSR people in Indonesia. So I hope the people, poor people, to live together. Okay, next slide. Okay. So I thanks to the Ministry of Education and Culture, the Republic of Indonesia, because they also share some fund to the university, as well as also some information, because we together in to support people and health facility through from university. We also thanks to the pharmaceutical company, especially, and all this company that can boost in my presentations, because we also insights activity to my presentation. And the last one, college from NGO that enforce together to support people to fight the COVID-19. And again, I also thanks to my colleagues in fighting COVID-19, and thanks to the Science Technology Foundation to conduct this virtual meeting. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. Please, if you have any question or comments, please.
Okay. Thank you, Professor Daryano.
Thank you.
I guess we don't have good connection to ask questions. Then we're thanking Professor Daryano from Indonesia to share the experience of Indonesia, the support of NGOs, companies, and people to support the country and people indeed. Thank you. And with that, I would like to invite Professor Iraj Harichi, Deputy Minister of Health and Medical Education from Iran. He's going to talk about Iran's experience in fighting COVID-19, and the talk is in Farsi and we'll have translation, of course. خیلی ممنون آقای کوهریچی، لطف کردید. البته برنامه سخنرانی آقای کوهریچی سخنرانی افتتاحیه بود، ولی چون کاری برای ایشون پیش اومد ما مجبور شدیم جابجا کنیم و الان در خدمتشون باشیم. نیم ساعت در خدمت آقای دکتر هستیم، بعدش هم پرسش و پاسخ. آقای دکتر روی استیج هم باید بیاین که آره که تصویر شما رو داشته باشن.
الان مناسبه؟
بله خیلی ممنون، در خدمتتون هستیم.
خب اگه اسلایدهای من رو لطف کنن. بسم الله الرحمن الرحیم. عرض سلام و ادب و احترام دارم خدمت همه همکارانی که در کشورهای مختلف صدا و تصویر من رو دارن و امیدوارم که بحثی که امروز داریم برای سلامت مردم همه کشورهای جهان مفید واقع بشه. من امیدوارم که با تلاش‌های علمی و با همبستگی که بین کشورهای مختلف ایجاد خواهد شد ما بتونیم به مرحله برسیم که پیشگیری و درمان بیماری کووید 19 رو بدون هیچ تبعیضی در بین کشورهای مختلف و بدون هیچ تبعیضی در داخل کشورها، یعنی بین فقیر و غنی، بین جوان و پیر، بین شهری و روستایی برقرار کنیم. علی‌رغم اینکه دیروز یکی از وزیر خزانه‌داری یکی از کشورهای بزرگ اروپای غربی اعلام کرد که بالاخره اگر واکسن کشف بشه اول کشور ما مقدم هست و بعد به کشورهای دیگه خواهیم داد. امیدوارم این فضایی که به وجود اومده و ناسیونالیسم افراطی و کشورها فقط به فکر خودشون هستن و گاهی میبینید که دزدی ماسک و دزدی وسایل حفاظتی انجام میشه به اتمام برسه و بشریت دست به دست هم بده و با هم بتونه کمک بده و این بیماری رو از بین ببره. من اول وضعیت ایران رو خیلی سریع با اسلایدا نشون میدم، بعد یه سری نکات برجسته‌ای هست از تجربه ایران که عرض میکنم. اگر اسلاید اول رو لطف بفرمایید. این از روز اولی که در 21 فوریه در کشور ما موارد جدید پیدا شد از این ویروس کووید 19 و ما بعد از نیم ساعت از کشف اولین مورد آزمایشگاهی اعلام کردیم. ما حد اکثر در حدود 30 مارس به 3186 کیس روزانه رسیدیم. بعد با اقداماتی که انجام دادیم روند نزولیمون به طرز قابل توجهی ایجاد شد، یعنی کیس های روزانمون تا 75% نسبت به پیکمون کاهش پیدا کرد. بعد به دلیل اینکه غربالگریمون رو خواهش می‌کنم به این توجه کنید، ما الان غربالگری و کنتکت تریسینگ رو در افراد به ترتیب کسانی که کم علامت و بی علامتن و در کسانی که با افراد مبتلا مجاورت داشتن افزایش دادیم. این چیزهایی که در نیمه اول می و تا دیروز میبینید حدود 80%شون کیسای بی علامت و کنتکت تریسینگ هایی هستن که ما انجام میدیم. دقت بکنید که من الان تو اسلاید بعدی رو اگه لطف کنن نشون بدن، ما مرگ و میرامون که در روزانه به حدود 157 و 158 مورد کیس کووید مثبت رسیده بود، الان در 10 روز اخیر عمدتاً زیر 50 هست و حدود 70% مرگ و میرمون کاهش پیدا کرده به تعداد و حدود 75% بستری در بیمارستانمون کاهش پیدا کرده و حدود 50% بستری در آیسیومون. این خیلی مهمه بدونیم که ما اون شاخص هایی که در طول زمان قابل مقایسه بوده به شدت کاهش پیدا کرده. دلایلش رو عرض خواهم کرد، ولی چون غربالگری و بیماری آبونیمون افزایش پیدا کرده، تعداد کیس های جدیدمون رو به افزایش نشون میده. اگه اسلاید بعدی رو لطف بفرمایید. این منحنی کیس های جدیدمون هست که تعداد کمولیتیو رو نشون میده، تعداد فزاینده. اسلاید بعدی. این تعداد مرگ و میره که همونطور که میبینید منحنی ما کمی روند صعودیش به طرف نزدیک میشه به طرف پلاتو و امیدواریم در چند روز آینده به پلاتو کامل برسه. اسلاید بعدی. این نکته مهمیه که من قبل از اسلایدهای بعدیمون نشون میدم. ببینید، چون ایران دومین کشوری بود که تعداد قابل توجهی بعد از چین مبتلا شد، یه سری اشتباه برداشت رخ داد. همونطور که الان میبینید اگه ما بخوایم کشورها رو الان تو سایت های معتبر کشورها رو با تعداد کیس خالص مقایسه میکنن و حتی همون سایت ها البته این به ازای 1 میلیون نفر هم هست. همونطور که ملاحظه میفرمایید ما به ازای 1 میلیون نفر 1433 کیس در 1 میلیون داریم. من